How does community rating work?
Well, an insurance company, they look at a community and see how many, they're insuring automobiles. They want to know how many accidents this particular locality is likely to have. You're going to have more accidents in New York City than you're going to have in rural Iowa. And so people in New York City have higher insurance rates. But it's a big community, whereas you don't have to pay extra insurance because you happen to live on a block with a lot of lousy drivers. But when they're providing it to a company, they look for the company and they say, well, this company has a lot of healthy employees, doesn't have many problems, and so they cherry pick those, and then everybody left over has to pay much higher rates because of that.
And this is why 65% of workers without health insurance work for companies with 25 or fewer employees.
Exactly. So if you have one employee in that 25 employee company, one employee who needs considerable and expensive medical care, everybody else, their rates go way up. Oh, and also often you can't leave the company because you wouldn't be able to get insurance, which is just plain wrong.
Has Obamacare fixed this?
No, Obamacare has not fixed it. I personally think that Obamacare was designed to force the end of private medicine and to, make socialized medicine inevitable. I think it was. I don't have nice things to say about Obamacare.
Well, say a few unnice things then. What are tick off two or three of the particulars here?
Well, it was done without, economics had nothing to do with it. They did it. It doesn't change the basic fee for service system, which is part of the problem. It forces people you can still go out and get insurance. I mean, if your house burns down, you can't buy the insurance the next day. But if you have a heart attack, you can buy the insurance the next day. And that's just plain wrong. That sends up everybody's prices again.
So the two other programs that we talked about the Blue Cross Blue Shield. Want to Medicaid and Medicare. The healthcare providers hated these because they hated the idea of socialized medicine. But then when the programs kicked in the 60s and 70s, and particularly the 80s, they loved it because people could afford services they couldn't pay for in the private system, and it's been with us ever since. But what are so once again, we've got more programs where we're not paying attention to what things cost.
Exactly. It doesn't, Medicare, you don't care what it costs. You just, the government takes the money every month out of your account. And also that's fee for service. It's again, the doctors have no incentive to compete in terms of price. And so they don't. And, the really big problem here is that every hospital has a list of what they charge, and it's a state secret. They will not tell you because basically what they do is they pay a lot less. Medicare and the big insurance companies have negotiated rates way down. So if you happen to be uninsured, you go to the hospital, you have to pay full freight, which again is just wrong. And actually, the Trump administration has required hospitals and other medical service providers to post their prices. Mm-hmm. And then what they did was they would say, well, procedure PQ17H is $5,000. And of course, you don't know what the procedure is. So they have to put in a new rule saying in English, please. And there are hospitals now, and they're spreading. There are more of them. The Surgical Center of Oklahoma, for instance, they post their prices online, and it's a complete package. If you need a knee replacement, you will go online, and they'll tell you it's $15,607 or whatever the sum is, and that's it. Whereas in most hospitals, you can negotiate the price, and actually some people have begun doing that. They go to Oklahoma Surgical Center, find out what the price is, and then go to their local hospital and say, "Will you do it for the same price?" So they have these nominal prices, which are, nonsense. If you look, when I get from Medicare. It says the doctor charged $150 for something or other. Medicare allowed 37, and the doctor took the 37. Well, he's obviously not losing money. I mean, so where does this $150 come from? It's a phony price. Everybody should have to post their prices, and then once you post prices, once hospital A says we'll do it for $15,000, then hospital B is not going to be able to charge, $25,000, because people are going to go to hospital A, and the insurance companies are going to go to hospital A.